Hey, what's up? My name's Q. For my healthy promotion topic, I chose communities, preferably school institutions K through 12, as where I'd like to work with because I believe it's important. I have kids, and so my interest is already there. Number two says describe type of healthy promotion program that I would like to implement that I think is beneficial. Basically, the health promotion that I would like to implement would be part of the school institutions, creating a healthy lifestyle for our K through 12, kids through adolescence. So what I would like to do is get with the schools and have a registered nurse on campus and maybe a registered dietitian who could quarterly come and follow up with what the registered nurses testing results show. It can be as intricate as lipid panels and metabolic rate, looking at cholesterol and so on, depending on possibly student or patient issues, or just the basic vitals, checking heart rate, resting rate, and BMI and stuff that's already implemented, but basically making sure that that the children are having a healthy nutritional diet. And one of the things that could be implemented between getting this information, like the blood work doesn't technically have to be done at the school institutes. It could be done at their primary care physician pediatric office, and that information could be shared, or vice versa. The registered nurse could also help families that may not have health insurance to get the testing done. So number three is basically asking me, so who the community stakeholders would be. So I would like to basically get funding and endorsements through the local hospital organizations and healthcare systems in the communities, as well as local grocery stores, and other health and fitness entities that would like to be involved with the community and keeping children healthy. I believe the state would also get involved in articulating any sort of program once the wheels are rolling. I believe it would cascade between all the groups, and it'd be a turnkey situation. The tools that would be beneficial to the program technology-wise, I think with the healthcare systems and hospital systems already having their own HIS systems, which is health information systems, and applications like even locally we have with Intermountain. Some of them are called My Health. You could use these applications, whether it's on a smartphone or a computer, to share the data, and that way the information can be shared between all three parties: the school institutes, the healthcare providers, the parents, and possibly even the local grocery stores. If they came up with more of a healthy living plan for the schools and got funding through the state, they could have like more of a regular checkup as well with their involvement, so they could break down nutritional needs per patient or student and their families. I forgot to mention, like, they could, if the state was involved, they already have reduced meals for families and their kids. So I was also thinking that they could send home dinners and meal preparation kits with the kids to help them through the weekends and the nights if their parents, their families don't have those resources available, and possibly even help out the families based upon a screening system, of course. Some of the challenges, I think one of the main challenges I kind of answered or didn't maybe mention it, but I meant to mention it in number 2. We would need parental consent, of course, to implement a program like this, with all the privacy acts we have nowadays. So that brings apart the second challenge, which would be just getting past the laws and regulations, according with HIPAA. For anybody who doesn't understand what that is, it's a Privacy Portability Act that basically ensures privacy. So I'm sure with all state entities involved, that ball would get rolling very, very easily. But that brings me to my last challenge, which I think the parents that would be involved with this building in the community, I think that would be a challenge just time management wise, with being a single dad and the busy lives that most of us have, and the extracurricular activities our kids already have, our own family time and our jobs and so on and so forth. I think that would be the biggest challenge, is how to get and make sure parents want to stay involved. So I think ease of application would be the easiest thing. All this is done at the school and shared between the healthcare providers and whatnot, and then at the ease of a button, the parents can access the information. Nowadays, with everything that we're doing everything virtually anyway, so they wouldn't have to come on campus to do a meeting. If they want to speak to a dietitian or the nurse at any time, they could set up virtual meets through Zoom, and I think this could help create a more healthy lifestyle for maybe underprivileged kids that have, childhood obesity at a young age, which could maybe prevent them from, juvenile diabetes and other sorts of preventative diseases. So, thanks.